everyone, I am Dr. Swati Kumar. I am a consultant neurologist in Fortis Hospital, Anandapur, Kolkata. Today I will be telling you about demyelinating disorders of the central nervous system. So let us start by telling you what is demyelination. So we have to think about our brain and spinal cord as a huge network of wires, whereby the nerves are the wires and they are insulated by a material called myelin. When this is lost, there is problem in circulation of the information in the brain and spinal cord, causing problems in the network and various manifestations. You can think of it as a network like the internet, and if the signal is dropping out, then you will not be able to get the information. So what causes demyelination? It is most often than not caused by problems like autoimmune disorder. That is, there is a problem in the defense system of the body which causes it to attack on the nerves without any particular reason. So this attack on the nerves causes damage to the myelin sheath, and as a result there is problems in circulating the signals in the brain and spinal cord. So how does it manifest? It may present with vision problems, you are not able to see. There can be problems in clarity and color vision. There can be double vision. It can be presenting as weakness of one part of the body, like the legs, the weakness in the face. Then it can present like tingling, numbness, symptoms like difficulty in urination, bladder problems, or it can present with imbalance, clumsiness, difficulty in speech, or excessive fatigue. So it is important to identify these problems, as what happens in these disorders is that it recurs. So it might improve on its own or with medication, and then again it may happen. So we have to be very careful. If these kind of symptoms are happening or they are recurring, then we have to immediately see a neurologist for this. Now, how do we diagnose this condition? We diagnose it with the help of a history, a proper clinical examination, as well as with the help of certain tools like MRI, which help us to see the places where the demyelination has occurred. Apart from this, we can do some blood tests to help us get to know the antibodies which are causing this, and some tests like the lumbar puncture, which helps us to test the cerebrospinal fluid or the fluid in the spinal cord. So this assimilating of this information will help us to make the diagnosis. Now what is the treatment? It is a very much treatable condition, and with prompt diagnosis and timely treatment, a patient can lead a near normal life and enjoy all the activities of normal daily living. The treatment mostly involves the treatment of the acute attacks as well as long-term treatment to prevent the further attacks, as well as symptomatic management. So the take-home message is, this problem involves patients in a young and productive age group. So very important to identify sudden symptoms like the vision problems, the balance problems, the weakness, and report to a neurologist, get the timely diagnosis and treatment which will help you to lead a normal life. Thank you.